Well, hello, and a very warm welcome back to the Andrew Eborn Show. And it's this part of the show where we get the medical experts in to talk about the issues that have been concerning you. Well, one issue that's concerning me, and that's a red eye. And there is nobody better than Professor Ananth Viswanathan from Moorfields Hospital. How are you, Viz?
I'm very well, thanks. Yeah, sorry to see you're having some trouble with your eye there.
Well, they all sort of arrived on the plane. It was the red eye, as they say. So you have
Ah, very
I
good.
thank you. I'm here all week. It's rather good. So I thought I'd better bring it up. Here we go. This is what it looks like.
Hmm.
So
Yes.
tell me what's wrong with it.
Right. Well, I mean, that is the kind of photo that, as a medical student, you might be shown and asked to make a spot diagnosis. You could literally put that in the exam for people to become doctors. Obviously, normally you ask the patient what happened and how they noticed it and this sort of thing. But if you were just shown that photo on its own, that is a textbook example of what's called a subconjunctival hemorrhage. So your the white of your eye, the sclera, is actually covered by a translucent membrane called the conjunctiva, which has blood vessels in it. And that's why when that membrane gets inflamed, it's conjunctivitis. But if one of these conjunctival vessels, which are tiny, leaks a bit, then the blood can gather under the conjunctiva and it looks very dramatic, very dramatically red. But what you're seeing in that photo is way less than a milliliter of blood. So these things just happen. I mean, obviously, if the eye gets another injury, then it can happen as a secondary cause, but quite often they just happen on their own. Most of them just happen on their own. So, you wake up in the morning or during the day, it develops. You think, goodness me, my eye's gone very, very red. But the way you know that it's not inflammation is that what you're seeing there is quite a solid patch of red over the white of the eye. But if you look at the bits of the white of the eye that aren't affected, the blood vessels there are the normal shape. They're not enlarged or anything like that. And also in general, if this happens to you, you really don't get discomfort or pain, and you don't really notice a change in vision, except that sometimes it can mean that the eye doesn't wet properly when you blink. So it can feel a little bit irritable, but not more than that. And any very small visual problems, when you blink, the eye resurfaces and it goes away. So that's why people, although it looks dramatic, they don't have any other symptoms other than noticing this dreadful red eye.
Right. And what are the likely causes of this?
Well, as I say, mostly it just happens. One of the little blood vessels in the conjunctiva leaks a bit, and that can happen again a few weeks later. It usually doesn't keep happening. But there are some other underlying causes. So high blood pressure can be a cause of it, or also if you're on medicines to thin the blood, that can sometimes cause it. And other things are doing what's called a Valsalva maneuver, so straining as though you're lifting a heavy weight, right, or you're straining on the loo. That puts the pressure in those little blood vessels up and makes them more likely to leak.
So basically, anybody can get a
Oh
red eye,
yes,
effectively.
that kind of red eye is actually pretty common, but because it looks dramatic, people understandably get concerned. But it isn't something to be hugely concerned about.
Very good. So what then is the treatment? What's the best thing people can do if they get one of those red eyes?
Well, if it's not causing you bother, so if the eye is fairly comfortable, which it usually is, you just wait, and it will go away on its own. And a little bit like a bruise on the skin can sometimes go a little bit yellow or green before it disappears because the hemoglobin in the blood's getting broken down. That may happen as well. But over about 2 weeks, it will disappear, and it doesn't need any specific treatment. If the eye does feel a little bit irritable, then just some your pharmacist will be able to advise you on some over-the-counter lubricants, artificial tears, things like that, just until it gets better.
And what should people expect? I mean, what is the outlook then? I mean, in terms of how long it takes to heal.
It's usually, as I say, it's over about 2 weeks. It gets dramatically better over 3 or 4 days and then fades away completely over the rest of the 2 weeks. It may then happen again, a few weeks later, um, but it won't keep happening forever.
Right. And in terms of when people might have to be worried about a red eye, when they need to phone up the doctor, what are those sort of circumstances?
Well, at Moorfields, we're very lucky. We've got a very busy and good A&E department. So obviously, if there's been an accident and your eye's red as a result of that, you must come along to get it properly checked out to make sure there's no damage to other structures within the eye. But things that might make you want to seek medical help anyway would be if the eye really is, you're in proper discomfort, not just mildly irritable, but you think, no, this is really bothering me. That level of discomfort, you should go. And particularly if your vision is persistently affected. So, with a subconjunctival hemorrhage, you may notice your vision's not as good as it was, but when you blink, it's pretty much normal. If you think, no, this is not as it should be, that should make you go along and seek help. So it's discomfort and changes in vision, persistent changes in vision. And you shouldn't delay because you need a proper eye exam and someone to look at all the other parts of your eye.
But generally, I mean, a lot of people will be affected by this, and you're saying there's no need to worry.
Certainly not. If you just wake up, you go to brush your teeth, you look at them and think, goodness, what's that? As long as your vision's fine, the eye's comfortable, probably if you haven't had your blood pressure checked recently, it's worth getting a blood pressure check. If you are on blood thinners, you might want to consult the person who's prescribed you those blood thinners to say, I've just noticed this. But if you're on those tablets, you would be told anyway, if you start to bruise too easily, let us know. And this counts as one of those.
And finally, a lot of people say the common thing with airlines, I've just arrived on the red eye. Is that anything to do with it?
No, sadly, that's really, I think that refers to the fact that you don't get much rest. And you're exposed to rather dry cabin air for many, many hours. So then you get mild conjunctival inflammation, and all the vessels in your conjunctiva are a bit enlarged because you feel awful. You've not had enough sleep.
Oh, fantastic. Brilliant advice, as always, very reassuring. And what we love about these little episodes is that it actually eases the pressure on places like the NHS, where they're not being burdened by questions that can be answered in the general sort of format. So we're going to get you back. But for now, Professor Ananth Viswanathan, Viz, as I like to call you, everybody calls you that. It's not so much of a mouthful, although Viswanathan, I've got it down to a T now. It's going
you have.
Thank you very much for joining us.
It's a pleasure, Andrew. Pleasure to see you.